Hi, everyone. Our project is being conducted in Fraser Health Authority, and it is on creating a regional strategy for gender inclusivity. I want to start by acknowledging our partners within Fraser Health, the BC Support Unit, and also the Canadian Institute of Health Research, who had provided funding for this part of this project. I also want to acknowledge our consultants from Transfocus Incorporation. The experience of trans, non-binary, two-spirit patients and employee is characterized by exclusion and inequitable access to care and services. I will ask Michelle to please share the slides.
Sorry, we're having some tech issues. Our slides aren't coming up, so please continue, Moji, and I will try to keep getting them to come up as you continue.
Cool. So the severity of the harm and negative impacts that exclusion and inequity is having on the health, well-being, and quality of life of these individuals cannot be overlooked. To investigate and evaluate Fraser Health's approach to gender diversity, Fraser Health Ethics and Diversity Services initiated a region-wide system-level ethics consultation process to review how our systems, programs, and services typically function and develop, and we have recommendations to improve these functions. In addition, a literature search was conducted that showed that gender diverse individuals typically face unique challenges across 5 areas, namely interactions, gender records, gender and sex data, programs and services, and built space and equipment. These key areas become the guiding framework for our research. To identify barriers and facilitators to gender inclusion specific to the Fraser Health context, Transfocus Consulting was contracted to conduct a comprehensive mixed methods consultation process, exploring each of the 5 key areas in depth. Our methods that were used included interviews, focus groups, surveys, including a total of 488 employees and patients at Fraser Health.
So what did we find? The 5-month multi-stakeholder engagement process surfaced a multitude of barriers and facilitators to inclusion within these 5 focus areas. Today we will cover just a few. Many of these findings are not specific to the Fraser Health context, but represent the plight of trans, non-binary, and two-spirit individuals accessing care or employment in any context. One of the most common issues faced by gender diverse patients and employees is being misgendered and misnamed. For many individuals, their prior name or gender designation is a source of significant trauma and hardship. The repeated use of this name or gender only serves to increase the impact of that trauma and creates a barrier to accessing care or feeling accepted in the workplace. Stemming from this issue, a number of gender diverse patients report healthcare providers making incorrect assumptions about their anatomy and therefore prescribing incorrect medical tests or procedures. Certain records for patients and employees, such as first names and titles, frequently result in automatic and subconscious gendered inferences during interactions. One way to inform others of gender identity and to circumvent this assumptive process is to collect third-person pronouns, although this is not yet commonplace practice at Fraser Health or at society in large. Gender and sex data. These concepts of sex and gender identity are complex and interrelated. In the healthcare context, sex designation is typically used to determine one's sex characteristics. However, for this population, sex designation does not necessarily map to sex composition, depending on what types of gender-affirming care an individual has accessed and where they are in this affirmation journey. This means that Fraser Health's data systems don't accurately record variations in sex compositions for trans, non-binary, and two-spirit bodies. This could result in inadequate information for the healthcare provider and inadequate or inappropriate care for the patient. Gender diverse patients often avoid care based on past or anticipated challenges, especially within the emergency room, mental health services, and traditionally gender-specific services such as maternity care. The consults also surface the need for more competent primary care, access to gender-affirming care, and dedicated mental health services. In addition, there's a need for coverage of gender-affirming care and extended benefits for trans, non-binary, and two-spirit employees, and guidelines for disclosing or transitioning on the job. Information emerging from the consults also suggests that the most significant issues for patients and employees alike include the accessibility of appropriate washrooms and change rooms. Specific to patients, issues arise when beds are assigned by gender and gendered medical equipment is incorrectly assigned due to assumptions of anatomy based on gender. Over the coming months, a collaborative working team of Fraser Health staff and patient partners will deliberate through modified Delphi methods over the recommendations to select and prioritize key recommendations to be implemented throughout the Fraser Health region. This will improve our approach to gender diversity for our patients and our employees alike.